The Code of Conduct is an overarching practice standard describing the behavior and conduct all nurses in Ontario are professionally accountable to. There are 6 principles in the code. This section of the webcast will focus on Principle 6. Principle 6. Nurses maintain public confidence in the nursing profession. In this principle, nurses demonstrate how they build public trust by being accountable for their actions and decisions, and by advocating for their patients and practice settings. We will review 3 scenarios that will show how nurses demonstrate Principle 6. Scenario 1. Taking accountability for mistakes. Fahad is a nurse working in a hospital research area. Noah, a research participant, consents to receive an experimental medication. Noah's physician provides the order for Fahad to give the drug. While Fahad prepares the medication, he gets distracted and accidentally draws a different medication stored in a similar blue vial as the experimental medication. Fahad gives Noah the wrong medication. What should Fahad do? Fahad reviews the Code of Conduct and the Medication Practice Standard. He learns he is accountable for his own actions and decisions, and that he is required to report medication errors, near misses, or adverse events in a timely manner. After reviewing these expectations, Fahad understands he must take responsibility for this medication error. Fahad informs Noah's physician of his mistake. He completes the organization's incident report and appropriate research forms. Fahad also informs Noah of his medication error and explains the care he intends to provide going forward, such as working with Noah's physician to monitor and assess any adverse reactions. Fahad reviews the incident report with the clinical manager and other nurse researchers. He advocates for different processes and policies to prevent similar medication errors in the future, such as appropriate storage and labeling of research medications. Scenario 2. Protecting patients from harm and maintaining health. Marcus works on a surgical inpatient unit. He often works with Mary. Marcus notices Mary frequently asks him to co-sign for wastage of controlled substances he has not witnessed. Mary works mostly night shifts and takes longer breaks compared to her other colleagues. Marcus isn't sure what he should do. He considers saying something to their manager about Mary's behavior, but he doesn't want to get Mary in trouble. He also feels he should not be responsible for monitoring her. What are Marcus's accountabilities? Marcus refers to the Code of Conduct and finds out he is accountable to protect patients from harm and report any behavior or conduct affecting patient safety. He also understands nurses do not practice when impaired. Marcus reflects on the situation and understands while he does not want to upset Mary, his duty to protect patients comes first. Marcus discusses his observations and concerns about Mary with their manager. What are Mary's accountabilities? As a nurse, Mary is accountable to the Code of Conduct. She is responsible for maintaining her health and seeking help for health issues affecting her ability to safely practice. After reflecting on her situation, Mary self-refers to the Nurses' Health Program, a voluntary program encouraging nurses to seek treatment for substance use and/or mental health disorders. Scenario 3. Respecting patients' property. Lorraine is a nurse working on a mental health inpatient unit. She is training a nursing student, Stephen. While doing rounds on the unit, Lorraine finds her patient Eve has left a book on the floor of her room. Lorraine tosses Eve's book into the garbage and tells Stephen, "That's what happens for leaving such a messy room." After hearing this, Stephen is very uncomfortable. He feels Lorraine did not have the right to throw Eve's book in the garbage. He is unsure if he should say something and wonders what a nurse's accountabilities are about patient property. What should Stephen do? Stephen reviews the Code of Conduct and finds that nurses are to respect the property of their patients. He feels what Lorraine did to Eve's book was disrespectful and does not align with this accountability. After reviewing the code, Stephen shares his concerns with the unit's clinical manager. Together, they approach Lorraine about the situation and remind Lorraine about her accountabilities. The manager takes steps to assess Lorraine's behavior and conduct. They review the Mandatory Reporting Process Guide for employers, facility operators, and nurses. They also consult with CNO's reports team. This concludes the Code of Conduct webcast. More information about the code, as well as additional practice resources, translated versions of the code, and answers to frequently asked questions are available at www.cno.org/Code of Conduct.